Get
Well,
it?
good morning. Happy Wednesday,
Great morning.
everyone.
Good
Go ahead
morning.
and put it on to Michael.
Yeah. Good morning, everybody. I'm pumped. I'm super excited. If you don't know who I am, my name is Mike Kaplan. I'm the head of recruiting here at Global Premier Benefits. So I want to just welcome you guys to this info session with Devoted. We're going to hear a lot of great things today. So I please just pray that you take a lot of notes. Definitely mute your microphones unless you're asking or, of course, answering a question. And then type your questions in the chat line below if there's something that comes up during the presentation that you want to know a little more info about, okay? I'm really going to be behind the scenes more so than sort of in front of the camera. So I just want you guys to know there's somebody moderating the slides after the fact. But without further ado, I'd like to introduce our MC of the day. No pun intended, because those are my initials. But Mr. Tony Holland's been in the business a really, really long time. As I like to say, almost as long as I've been alive. And if you've been in the Medicare space for more than just this selling season, chances are you've heard of Tony before. Tony's been in the final expense game. He's been in the Medicare Advantage business, and he truly is the leader that we look for. Kind of the diamond in the rough. And if you trust, Tony, what's your phrase? If you give me 1% of your trust, I'll earn that other 99%. You truly did earn my other 99% as a couple years that I've been with Global. So what I'd like to do is just pass the mic over to you, Tony. And without further ado, ladies and gentlemen, Mr. Tony Holland.
Well, thank you for that amazing introduction, but I think everybody on this call is not here to hear me.
Fair enough.
They're not here to hear me. I'm going to share some things at the end, and I thank you for that wonderful introduction. I'm the new managing partner with Integrity Marketing Group and founder and CEO of Global Premier Benefits. But I'm honored to introduce a gentleman I've gotten to know recently, a true legend in our industry of Medicare. And you guys are in store for something extremely dynamic, very special. I assure you, you're going to hear some things today you've never heard before. Because I was like you guys, I was skeptical when I heard about this new company called Devoted. I'm like, not another daggone startup, because I was with a lot of startups from Clover Health to Bravo, HealthSpring, Zing. I mean, I've seen them all, and I'm like, I don't want to deal with another startup again. But when I got the chance to meet Ed Park and heard his story and his passion for the people and passion for this industry, that it is completely unique. It is different than anything I've ever seen. Ed Park is co-founder and CEO of Devoted Health. Prior to Devoted, Ed graduated from Harvard and was one of the key members of the original team that took Athena Health. Many of you guys have heard of Athena Health, from a basement startup company to a NASDAQ-listed company with over $1 billion, yes, with a B, $1 billion in revenue. He has served in multiple corporate boards and has been quoted in both trade and national media, including USA Today, Forbes magazine. He has spoken at the Economist Health Summit, U.S. News and World Report, Bloomberg Big Data Conference, and Get Down and Rock Health events, among others. Ed lives in Boston. I don't know if he's a Patriots fan or not. They're having some challenges right now. They'll get it on track. But Ed lives in Boston with his wife and 2 teenage daughters who definitely help keep him on his toes. We want to welcome the amazing, dynamic co-founder, like I said, and CEO of Devoted. Help us get up for Ed Park.
Thank you, man. Thank you. It is an honor to be here today. And as always, you know how to bring the beat. Thanks a ton. It's an honor to be partnered with you. And for everyone here today, thank you so much for taking time out of your busy days. These days are busier than normal. We're in the heart of the AEP now. And for you to take a few minutes out of your day to hear our story just means the world to us. So thank you so much for taking the time. What we're going to do here is I'm going to spend about 15 minutes sharing our story with you. And then from there, we'll go into more about us and answer whatever questions you have. But I'm going to go ahead and share screen here. Awesome. Thanks. Awesome. So Devoted's mission is to improve the health and life of America's seniors by treating each and every member like they're literally family. We have a prime directive that applies to everyone in the company from the board on down. And it's this: when facing a difficult decision about a member, close your eyes and imagine that you're making the decision for someone that you love. Then open your eyes check with compliance to make sure that what you're about to do is okay, but then just do that thing. No other authorization or permission required. And what would you want for the people that you love? You'd want the very best care in the world, not average care, not mediocre care, the very best care in the world. And we have a very precise definition of what we mean by that. It's the right care at the right time, at the right place. And so when my brother and I think about the people that we love, when we make our decisions, we think about these folks. They're our mother and father, Chung and Sundra Park, who raised us. We grew up in Columbus, Ohio, and they taught us literally everything we know. And whenever we think about decisions, we think about them. Before starting Devoted, we actually put this idea of right care, right time, right place in another company called Athena Health. So Athena Health's original mission was healthy bouncing babies. Like, our job was to actually create healthy bouncing babies. And we did that by trying to take better care of moms during their pregnancies so that we could reduce the number of NICU days babies would spend on the ICU in the back end. And we were fabulously successful with that. We were able to take care of thousands of babies and give them better lives and give their moms better lives. And the clinical model worked, but the financial model didn't, because it's one of the painful lessons I learned. Just because you do the right thing in healthcare doesn't always mean that you're going to get paid for it. So we pivoted the business model, and we became known as one of the best known electronic health record companies in the country. From there, we took the company public. As Tony noted, it was the top performing IPO on the NASDAQ in 2007. And I spent the next 10 years as a public company executive. But I never forgot what the first lesson I learned, which is you can do the right thing in healthcare, but not get paid for it. And the more I learned about US healthcare, the more it shocked me how badly we spend our money. So we're going to spend $4.1 trillion with a T on healthcare in this country this year. It's more than we're going to spend on national defense and K through 12 education combined. Taken as a country, it would actually be the 5th largest economy in the world. We're going to spend more on healthcare this year than the entire country of Germany is going to spend on everything. We're going to spend more on healthcare than we're going to spend on all retail goods combined. So you take everything that you would buy, furniture, clothing, jewelry, even cars, and put healthcare on the other hand, we're going to spend more on healthcare. Despite spending that much money on healthcare, we spend more than twice as much on healthcare per person as any other developed country in the world. Our outcomes are on par with Cuba. They're really, really, really poor. And why is that? It's for reasons that any of us who have been in this business for any period of time know. It's because we spend all our money on train wrecks after they've happened and not enough on preventive care to prevent the train wrecks from happening to begin with. That's why we are spending so much money on healthcare. So the big question for us, the big question that we had was, how could you do this differently? Like, how would it be possible to create a different kind of company that would, in fact, do well by keeping people healthy? And what was clear to us is that we had to start from scratch. We had to start from scratch because you couldn't start from, for example, we'd done well enough in our previous company that we could have bought a Medicare Advantage health plan. But my brother, turned to me and said, "Hey, look, starting Devoted by buying another company, by buying an existing Medicare Advantage plan would be like Amazon starting off like by buying Kmart. That dog ain't gonna hunt." And so we decided that we were going to put together a different kind of company just from the very, very beginning. And the earliest observation that we had about it was that there's an essential problem with the consistency with which we deliver the right care at the right place at the right time. So a bunch of you, I think, go into members' homes all the time. And you go to a member's home and you ask them what medications they take, and they come out with this box of like 27 medications. And the 27 medications, they say, here's all the medications that was prescribed by my 15 different doctors. And so I take them all. And you're like sitting there thinking, there's something wrong with this. And then it turns out that 10 of them are in fact expired. And now you're like, I'm pretty sure there's something wrong with this. And in fact, there is something wrong. We had a member a couple of years ago that we were looking at. She went to the emergency room because her PCP and endocrinologist had both prescribed 2 different blood pressure lowering medications. They both prescribed them. And she almost died because of that. And the truth of that matter is that it wasn't an isolated incident. We all know it happens again and again and again and again, and we actually take it for granted. We take it for granted that that's actually the way it's supposed to work. We take for granted that folks get diabetic amputations and because their diabetes is out of control. We take for granted that people with sickle cell go to the emergency room every month, despite the fact that if they just get hydrated, they just drink a little bit of water, more water, they wouldn't have to go to the emergency room. We take all these things for granted today, and we shouldn't. And that's why we started Devoted. One thing about that, when we started Devoted, is that we knew that upon starting Devoted that we had to do things differently. And to do it, we took inspiration from other companies that have changed the experience that members have. So we went to Howard Schultz, who is the CEO and founder of Starbucks, and asked him, how did you do it with Starbucks? How could you deliver a consistent cup of coffee, that's a good, consistent cup of coffee everywhere in the country? Like prior to Starbucks coming along, I don't know if you guys remember, but coffee was terrible. It was terrible. I think the only thing people remember about coffee was the woman who got burned by the coffee at McDonald's and got paid like $1 billion in the lawsuit. It's terrible. It was terrible. And Howard Schultz came along and actually made it so that you could consistently get a good cup of coffee anywhere in the country. We asked Howard, how did you do it? He said, it begins with culture and it begins with what you're trying to do. He'd come back from Italy and found the coffee culture of Italy. And so Starbucks was actually not founded on great coffee. It was actually founded on great culture. It was founded on stories. And he said, you take those stories and you deposit them in the piggy bank. And you earn trust over time, and you never actually withdraw that trust from the piggy bank. And so that's when we knew we had to start a company from scratch with its own culture, with its own technology, with its own model, with its own plan. And so we came up with this, and this is what my brother and I thought through. After spending decades in the industry thinking about what would need to be true to create a different kind of healthcare experience, one in which we were able to consistently deliver the right care at the right place at the right time. And the answer was Devoted. The first piece of Devoted, the piece that I think everyone understands about us today, is that we have our Devoted health plans, right? So this is our 5-layer cake. It's the 5 core ingredients that describe Devoted. The first layer is the plan. And the plan is a Medicare Advantage health plan that has the benefits and the network that are required to keep your family healthy and on the right track. To be honest, it took us a long time to come to the conclusion that we actually had to build a Medicare Advantage health plan because growing up in Ohio, like the people that I loved and I looked up to, I got to meet John Glenn, who was the first person to circumnavigate the globe in a spacecraft. Like that, you want to be an astronaut growing up. Like you don't want to be a health insurance executive growing up. Like those are the guys that in B movies get eaten by sharks. And then the entire audience cheers, right? Like I had no desire to be a Medicare Advantage health insurance executive. Like that was never the goal. But what was clear to me after 20 years of looking at this is that if you don't control the flow of funding, if you don't control how healthcare is paid for, your ability to change the way that the healthcare product is delivered is zero. You're too constrained in your ability to do that. And so the first layer of this was to build our own Medicare Advantage health plan. The second layer of Devoted's 5-layer cake is our guides. So our guides are our secret sauce. They're professional son and daughter service. We think that customer service, concierge customer service, is incredibly important to delivering and building a trusted relationship with our members. So our guides are, you can think of them as a professional son and daughter service. They pick up the phone 80% of the time within 30 seconds, and they'll stay on the phone for as long as it takes to resolve the members' questions. Our members love our guides. They love our guides, and they frequently ask for them by name. Our guides are all based in the United States, and they will be forever. Like, we think it's really, really important that we're able to talk with our members in ways that are empathic, that are culturally understood and appropriate, and that we develop the right relationships with all of our members. And so that's really, really important to us, and has turned out to be an enormous differentiator in the experience that our members have with us. The third layer of the cake is our partnerships with local providers and health systems. So we know we can't do this alone. And so we make sure that we get out of the hair of our providers and make sure that they have both the data they need to do their work, and that we're the easiest plan for them to do business with. So we'll credential providers in 2 weeks on average. And that's all the way from the first credentialing to the time that they appear in our provider directory. The average in the industry is 3 to 6 months. We'll pay 90% of claims within 5 days. We'll process the majority of our authorizations within 72 hours. We think there's no reason to sit on all this stuff. It just causes friction with providers and with members, because if a claim goes unpaid for a long period of time, what happens? The person sits there and asks, what's up with this? They start calling you. And then at that point, you're in this phone tag, when if you just paid the claim correctly to begin with quickly, you would have eliminated a bunch of that downstream cost, which does no good to anybody. So we think it's really important to have the right kinds of partnerships with our providers. The fourth element of what we do is we have our own devoted medical group. In every state, we have a virtual and in-home medical group that offers a set of wraparound services to our primary care physicians. So, questions like, why does this exist? Why did we decide that we needed to build this? And the reason is because there's a hole in the way that healthcare is delivered. I don't know if you have friends who are PCPs, but I have a bunch of friends. It's a very difficult profession at this point. You're seeing 15, 20, 25 patients a day at 10 minutes a pop. You're just trying to get through your day. After the fourth patient, you actually, like, there have been a bunch of studies on this, they lose empathy. It's just, they're trying to get through their day. And so you ask the question, why is it that you have those members who have 27 medications, and with 10 of them that are expired? Why do you actually have people who prescribe 2 different blood pressure and lowering medications? Why is it that when a member or a patient leaves the hospital, everybody knows they're supposed to see their PCP within 5 days of discharge? Why does this happen less than 10% of the time? Like, all of these things happen again. Why do people not get the diabetes education they're supposed to? Why do, we had a diabetic, I was at her house and she was injecting her insulin into her arm muscle in the same place every time. And we're like, don't you know that's not how you're supposed to inject insulin? You take different parts of the body, you pinch the skin, and you try to get into the bloodstream, because it doesn't do any good to lower the blood sugar in your muscle. Like, you're trying to do it in your bloodstream, in your body. That's the point of it. But no one had ever bothered to tell her the right way to take her insulin, and it was causing her massive insulin spikes. These sorts of things happen again and again and again and again. And so Devoted Medical offers a set of wraparound services to make sure that each of our members gets the right care at the right place at the right time. And we work with all of our PCPs to ensure that all of those wraparound services are delivered in a consistent, proactive fashion. The last element of the Devoted 5-layer cake is the Devoted software platform. It's Orinoco, which is a system that we built in-house with the latest technologies, and is completely integrated. It has everything in it from customer service, customer relationship management, all of our customer service, claims, authorizations, provider directory, broker portal, provider portal, member portal, our own electronic health record. It has literally everything all in one. And the reason that's important is because if you're trying to deliver right care, right place, right time, it's incredibly difficult logistically. But even more so, if you're on the phone with a member, and I've talked with folks at other health plans who say, at the beginning of every day, I go through and open up 15 different windows, one into the enrollment system, one to the authorization system, one to the claim system, one to a member CRM system, to try to ensure that I have all the systems ready and up and running so that I can answer questions about our members. As a result, like, A, it's incredibly hard for them to get up to speed. B, it's really hard for them to focus on the member because they're spending all of their time trying to navigate their way through this Byzantine maze of 15 different systems, many of which will give different answers. So like, what's the status of the member? It depends on which system you're looking at. And so it's really important. It was always important from our perspective to have a single source of truth that was real time and made sure that we could actually deliver the right answers in a one and done fashion. So that was the Orinoco and devoted product invention that we were contemplating as we launched this company in 2017. And then what happened next is something that we can't quite explain because it exceeded our wildest expectations. I'll start with the our net promoter score. So when you look at our net promoter scores, our members actually love us. They're stark raving mad about us. We've run the tables on 5 stars on a couple of the star rating measures, overall rating of health plan customer service in literally every market that we're in. We're the only other plan, I think, in the country besides Kaiser that has all of its plans in 4+ star plans. So all of our plans are 4+ stars. We're 5 stars in Ohio this year. And that's our first year out of the gate because of our incredible attention to detail. Our net promoter score, which is a measure of member satisfaction, is on par with the 77 here is on par with Apple, Amazon, Netflix, USAA, the Ritz, Tesla. It's 5 times higher than the industry average. And it's a testament to how much our members love us. 60% of our members refer us to have referred us to a friend. And I continue to look at where our new members are coming from. I saw this survey the other day where a member basically said, I heard about you at a birthday party, where one of my other friends had a birthday party and they started talking about you. Another member put together a booklet. She basically put a booklet on Why Devoted that she gave out to her 50 best friends. We have brokers who come to us and say, for every Devoted member I sell, I get 2 more because my friends tell all of the rest of their friends. And that, I think, is a testament to the amazing work that our member service team does with our members to ensure that they get empathic, great service, right care, right place, right time. When you look at our benefits, we'll go over this in a little more detail, but they are industry leading. But when you look at them, they're designed to keep people well. They're designed to ensure that our members have the right kind of benefits of care that are necessary to ensure that they can live long, healthy, happy lives. So, for example, you'll note that in all of our markets, we actually have the best no gimmicks dental benefit of anyone. Why is that, right? The reason for that is because there's a very strong correlation between dental health and overall health. There are published studies on the relationship between dental health and cardiovascular health. There are a lot, many of you know this already, but it's important to us that we keep our members healthy, because if we're able to keep our members healthy, then we're able to generate the necessary savings to plow back into better services and better benefits. And that's the cycle that has allowed us to be successful. And this systemic improvement, right? If we actually are able to take better care of our members, then we actually have more money at the end of the day, because every time one of our members touches the hospital, it costs us $10,000. So you can pay for a lot of dental for one hospital visit. So if we're able to keep them healthy, we basically save a bunch of money. We take that savings and we plow all of that money back into better benefits and into better service. And that's actually started a virtuous cycle in all of the markets in which we've operated. And the result has been that we are now the fastest growing Medicare Advantage plan in the country. And I would underscore this just because I think it's important that our philosophy of doing this has actually not been marketing based. We have a great marketing team, but there's a reason that in most of our markets, for example, we don't even have a field sales force. We are relying on the broker community. And we think that our job at the end of the day is to produce the best possible product. Like our differentiator is to produce the best possible product. And at that point, our perspective is that it's up to the community to decide whether we, in fact, have the best possible product out there. And so far, the community has voted with their feet and said, the broker community and the member community, and said, yes, this is an amazing product. It has great benefits, great service, and is the one that I would trust my families to. And as a result, we that is why we've been growing this so quickly. It's not because we have like a superior growth in distribution channels. It's because we actually are delivering a better product, and our job, that's our job. Like that's our job. And our job is then to make sure that we articulate that to folks who then make their own decisions about whether they believe that that's true. But so far, that's been true. Just a couple more things. These are just a couple of quotes. Our members, like, again, just love us. I'll leave this up here. Maybe I'll just read this third quote. Like, I don't really know how to put it into words, but when it comes to your company, I am, every time I hang up, like, isn't there anyone terrible at that place? I want all of you to come to my house and feed you. You know, they're like family, and that's the neatest thing, because everybody is so nice and does everything they can try to help if I have issues. And you're always so kind and helpful. We hear that again and again and again. Like our guides, there was a story the other day. Our guide found that a member had called on her birthday, and he took out his guitar because a bunch of our guides work from home now. Took out his guitar and started playing her a happy birthday song. Like, we have fun with it. Like our members are our friends. They're family. They love us. They'll call into our line and ask for folks by name, and we're able to answer their questions. Because we're able to answer the questions, and because we're able to generate that trust, we are then able to go beyond that and actually develop real relationships with folks. And so our ideal version of the world is that members call us and we're able to accurately answer their questions. And then they call you guys and they call you saying that they love Devoted, and they have more people that they would love to refer to Devoted. I think that there are lots of uses of your time. Your time is extraordinarily valuable. But dealing with missing ID cards is probably not a net good use of your time, or what the cost share was on on the dental visit. Like, that's just not a good use of time. Like, we consider that stuff to be our jobs. I would also note, as part of this, that a big part of our job, because our job is to ensure that we have a great product, it also needs to be a great product for brokers. We treat all of our brokers and all of our broker partners as first-class members of our family. We think that you are very important. We actually have the same service levels that we have for our members with our brokers. And for us, all of our brokers get platinum service. Like, you don't have to sell a certain number of folks in order to get great service. We actually think that all of our brokers deserve great service. And that's very important to us as well. The last thing I'll leave you with here is what I'm maybe the most proud of at our company. A couple of years in, there was a pattern that emerged that I didn't quite know existed, but then became very, very clear. And that is that all of our own employees started putting their own family members on our plan. They put their own fathers, mothers, sisters, brothers, cousins, aunts, uncles. Actually, some of them even put their in-laws on our plan, the in-laws that they liked. But they put everyone they loved on Devoted. And then we saw more coming on. I actually saw a lot of our brokers begin to sell themselves on Devoted. I actually saw our first application, this AEP, come over. I was looking at it. It came in from Texas. And I looked at who it was, and it was a broker putting himself on our plan. And they put their family members and their friends on our plan as well. And that matters to us because these guys know us better than anybody else. They knew who we are on the inside. And what they've said to me, I think time and time again, is that I am entrusting my loved ones to you because I know who you guys are. I know who you guys are. I know that if something goes wrong, you're going to take care of my family. And I know that you're going to try to prevent things from going wrong to begin with. And so you're the guys that I want to make sure take care of my loved ones. There's I don't know if any of you have a Macintosh, but if you've ever opened up a Macintosh, on the inside, it's a work of art. It's amazing. And the reason it's amazing is because Steve Jobs' father was a carpenter. What Steve Jobs' father said to him was, if you're going to do something, do it right. Build it right from the inside. If you are going to build a cabinet, don't use particle board in the back because it's going to flake out over time. And you're going to wish that you had never done that. If you're going to build a fence, don't build it with bad wood on the inside because it's going to warp in a couple of years and you're going to have to redo it. You're going to wish that you'd done it differently. We feel the same way about Devoted. For us, it's been very important to build this right from the inside. This was never for us about health insurance. It was never about building something big and hoping to basically get someone to buy it someday. This is the last job I ever plan to have. It is and for me and for my brother, it's a labor of love. We're trying to do something different and to build the product that we actually think that America's seniors need, that folks like my mom and dad and all of our friends actually need. And that's super important to us. We want to build it right from the inside. And so we've done it with great care every step of the way. And so with that, I thought maybe I could just spend the last couple of minutes showing you a video of some of our guides talking about Devoted in their own words, and then we'll take it from there. So let me see if I can get this going.
People do think of telemedicine practice as having a minimal impact, but I have the luxury of spending time with people and getting a glimpse into their life that I would never get in a medical office. I'd like to share a story about a patient I cared for a while. Her name is Miss Kathy. You see, her husband had recently been diagnosed with Alzheimer's disease and he was declining. And that was why she was forgetting her own medications. Her diet was poor. She would forget to eat. Her depression was worsening and she was isolated. I knew this woman needed help. It was my goal to make it easier for her to care for herself and to ease any burdens that I could. And I knew how hard the challenges of her life had become. So in every facet that I could imagine, I used the arms of Devoted and I wrapped them around her and her husband. We worked with the Devoted pharmacy team to bring her $500 plus monthly cost down to less than $10. We also partnered with a smart medication dispensing system called MedMinder, which basically sends her all of her medications pre-sorted and gives her a reminder of when to take them. And we worked with the community social work guides to get her assistance for caring for her husband, which allowed her to make those important doctor visits that she needed to get to. So I talked with Miss Kathy recently, and I can tell you her blood pressure is in great control, no signs of organ damage. Her diabetes is way improved. She's no longer considered morbidly obese, and she's very positive about her outlook on life. Her husband continues to do well too. I never thought I would be doing telemedicine with an insurance company, but the reason that I work here is because I actually get to treat people like family and spend the time with them that they deserve every day. I literally improve and save lives, and that feeds my soul, and that is why I love the work that I do.
My name is Diane and I work with the pharmacy team. I'm a pharmacy technician. So 2015, Father's Day, my father passed away from a major stroke. It's due to out of control blood pressure that wasn't really monitored well. Now when he passed away, it became my life's mission to check everyone's blood pressure. It was like something clicked in me. I do have a lot of members that I share this story with, but I have one that's really extraordinary to my heart. His name's Mr. James. I call him Mr. J. He didn't think it was our business. It's Devoted's business to know his blood pressure. He even asked me what my blood pressure was, and he's like, would you tell me that information? And I did, and I told him that I do check it every day, that I actually had it because when my father passed away, I had high blood pressure. I have hypertension myself. He said he works with his doctor. He sees him once a year. And I tried to explain the importance of checking his blood pressure, not just once a year, but regularly, if not every day. And I shared my father's story. I even told him, Mr. James, it doesn't matter if you share your blood pressure reading with me, as long as you check it. And you know that if you go over 140 over 90, you tell your doctor, I'll be happy. He said, I changed my mind and I'm going to do you a favor and me a favor. I will check it and I will give you those readings. So the end of that story is, I graduated him, meaning his blood pressure is under control. I see a little bit of my dad in every member that I talk to. You know, I truly believe that my story happened, my pain happened for this exact reason. It led me to where I'm at now.
Hi, my name is Odessa, but the story I'm going to tell you is about Mrs. Stell. She was very protective of her information, which is just fine. I let that conversation go, and then I called her again the next week. And the next week, she was more happy to hear from me. She did not expect me to call, as she said. I did not expect you to call me back. And it was at that time that she disclosed that she was on stage 4 lung cancer. We put in palliative care in the home and then eventually progressed into hospice care. I continued to call her about every week. One of the things that I think we do really well at Devoted is that we have learned to listen. And so in listening to her story, I learned how difficult it was for her to leave her husband behind. Overnight one day, I was woken up with her in my head. Mind you, I've never seen her, but I knew it was her. So I called her and she said to me, I'm so happy you've called me. And she said, you know, this is good because I wanted to thank you for calling me and for being there for me and my family. So I asked her who was with her. And she said that her husband was with her. All her children were now in the home and her grandchildren. And I said, well, it sounds like you're well supported and you have your whole family. And I'm so happy to speak with you today. She said, I want you to know that I love you for everything you've done. And I said, thank you, and I love you back. She passed away that day. What a privilege it is to work in an organization that provides me the time to give the time that our members deserve. I think that what the whole of Devoted does so well is to love people. And I think when people feel loved and heard and understood, they can't leave us. Love is what creates the quality of relationship that has built this company and will continue to build. It is the foundation. It is the magnet. People don't even want to leave the cities or the communities in which Devoted is in because they don't want to leave Devoted. So I thank you today for listening. Thank you.
Wow.
So thank you guys a ton. Thank you so much for listening to us and thank you for the time. God bless you. God bless the United States of America. May the force be with you, and we would love to welcome you to the Devoted family.
Thank you. Wow. Thank you. Ed, thank you so much, sir. Appreciate that. That was powerful. Love is the foundation of what Devoted Health is all about. You guys are definitely different. And Ed, you're an amazing individual and human being. I thank God every day that he brought us both together, and really excited about partnering with Devoted Health along with the Integrity family. So we're very thankful. Thank you, sir.
Thank you so much, sir.
Yes, sir. Have a great day, sir. So I need you guys to hang in there just a little bit. I know we had Mr. Park had to run, but I know some of his team members are still on. I want to make sure we gave a few minutes for you guys to ask a few questions if you'd like. Wow, that last lady, it was moving. You can see it was sincere, and I think you guys can see why now that I was so excited to hear about Devoted. I've seen a lot of companies, a lot of startups, even some of the big companies like United Healthcare and Aetna and WellCare. I've never met an executive like Ed Park. I've never. Just a passion for the people, believing in doing what's right, believing in creating the right kind of culture. We've all been, if you've been in this business long enough, you've seen the opposite of what Devoted and Ed Park is all about. This is definitely unique and different. I'm just so excited to introduce this to you guys in our organization. Even those of you that are not part of our organization yet, we're going to change that, by the way. I'm going to share a few things at the end, but I want to give some time for some questions. Michael, any questions that were chatted in that the Devoted team that's still on can handle on behalf of Mr. Park?
I don't see any questions in the chat, just a bunch of positive comments. I'll say that.
Yeah. Okay.
But by the way, you guys do have the ability to unmute yourselves if you'd like to ask a question or something to that effect.
Well, Mike, let's just go ahead and move forward because I want to be a good steward of everyone's time today because time is money. So again, I want to thank Ed Park. You can see why that he's a true icon in the industry, and just really excited about this new partnership and just overall seeing something different and special and unique for the seniors that we serve. And that's why I got in the business to begin with. It's about changing and saving lives. It wasn't just about the money. It shocked me when I was an agent to see all the challenges, especially in the HMO arena back in the 90s, what seniors were dealing with. It shocked me, how companies treated the clients. I mean, they were just a number, to create revenue. How even they treated their brokers. I've been with some companies that treated brokers like, it was a necessary evil. It was sad to see that. I just, with Devote, I just see something different and special and unique. And it does have that culture. It does have, love first. I felt that from the first meeting with Ed in Philadelphia. It's truly special. And I hope you guys got a little bit of an insight in terms of Devoted Health and why it's the fastest growing Medicare Advantage company in America right now. So I'm going to go some key things real quick about who we are for those that are new to Global and to Integrity. And if you're already with an FMO and you're happy, that's fine. But just take a look at us and what we're about, what we do. And we are special, unique. We're not just some IMO. Next slide, Michael. We're not just an IMO. Anybody, by the way, as an IMO can contract you. And if you're ready to get contract with Devote, that's fine. We have a link, but I want to share with you guys a little bit more about us. So we'll show this up again. But if you're ready to contract, you're excited, want to get started, especially you guys that are already familiar with Global. Many of you guys are already with us, don't have the Devoted contract. You can call Mike at 877-864-9317. You can visit our Devoted contracting link. It's pretty simple to do. Just make sure you know the affiliation. Holland Insurance Group is IE Global Premier Benefits /Integrity. So Holland Insurance Group Global are two the same company in one. Just Global was a trade name, just so you guys are aware of that. So when it pops up on the screen, you don't get confused. Next slide, Michael. So real quick, I'm going to keep this within 5 minutes perfectly, okay? So I want to give you guys some additional time to ask questions to me. So as you guys know, I'm the new managing partner of Integrity Marketing Group, was brought on board back in February. And a quick glance at Integrity, $12 billion of annual new premium, 11 million insurance covered. I think that's creeping up closer to 15 now. It's pretty incredible what they've done. This was actually published back in June. It's like unreal what has changed with this company. It shocked the whole industry. And when I was originally approached to join Integrity back about 3.5, 4 years ago, I'm like, I'm not interested. I was like blowing, like, I don't want to be a part of that. And then I started seeing some great friends of mine, competitors, make the move, and especially when Ryan Kimball did it with Agent Pipeline and then Mel Cope. I'm like, Lord, I need to maybe look at this again. And it just blew me away meeting Brian Adams and then getting to know Steve Young from the 49ers and the culture. It's exactly what I was looking for as an IMO, that, having the capital, having the resources, but having the technology. We have over 30 billion in assets under management. We have over 475 carriers, namely now Devoted Health, our newest Medicare Advantage partner, and then we're going really deep with them. And most of you guys have known my history. I was really big with Cigna. I was Mr. Cigna for many years, 13 years. We were their top traditional FMO for many years. And most of you guys know also I was one of the original founders of Senior Life. So I had an extent with life insurance, was big with Lincoln Heritage, and helped Clover get off the ground. You guys remember Clover and many other carriers, but there's nothing more special than I see with Devoted and my new partnership with Integrity. We have over 450,000 total agents and growing, and 6,000 employees, which is, the bigger infrastructure back office that we all need as agents. By the way, I'm still an agent at heart. I spent 8 years knocking on doors and dealing with the Rottweilers and dealing with, even the crack houses and being thrown out of houses. So I know what it's like to be an agent. So, and I think that's also what makes me unique as an IMO, that I've actually literally knocked on thousands of doors. Actually, one year did over 1,000 apps myself. So I've actually sold the product that I promote. Next slide, Michael. So, Integrity's lead platform. Many agents call me a lot. Say, Tony, the challenge I'm having. Yes, by the way, like I said, any IMO can contract you. Anybody out there can do that. Okay, but what do they do on the back end? Okay, really, the relationship with your IMO starts after the contract. Okay. It doesn't take any extra effort to do a contract. What do they do? Well, one thing, you're going to have my personal cell phone number. You can reach out to me anytime. And those that have known me for years, I'm very hands-on. I'm a field general. I'm not one of those generals going to sit down in an office in the Pentagon. I want to be out there amongst the troops, amongst the people that are putting their blood, sweat, and tears. I don't care if you're an agent that writes 5 apps a year or you write 5,000 apps a year. I'm going to be there for you to help you. And Integrity's lead platform, a lot of people have kind of leads you have, okay? So we have a platform that develops over 5 million new leads per month, including Medicare, final expense, and many other type of leads. So leads, by the way, are not a challenge. They're not. We got plenty of leads. I think we got too many leads. And I got a special note for you guys today that you hang on here for a little bit. I'm going to share with you surely a special surprise. I should have said that earlier, Michael. I got a special surprise for them that they're going to like. They get contracted. They go to the next slide, Michael, because I'm going to keep it rolling for the team. Global's leads and inventory, we have over 23,000 leads. Get this, 23,000 in inventory just in Devoted's health key markets alone. And they're all looking for a good agent to service them, okay? And I want to make sure you guys are clear. Now, we have a nice little training session on how to work leads. The lead is only, I've said this 1,000 times, a lead is only as good as the man or woman holding the lead, okay? The lead don't make the sale, you do. And if you have that right kind of passion, that right kind of culture, as Mr. Park talked about, it's not about the product, it's about the culture you create with that client. Okay, I don't have people in my database that I've sold. I have family members in my database that I love. That's the difference. See, if you're able to sell love and hope to people that are going through challenges, you'll sell more people you know what to do with, okay? So, guys, the lead is, again, only as good as the person holding them. So we have 23,000 leads looking for a good agent right now today in Devoted's key markets. Okay. And all you have to do, if you want to get contract with us, contract today, and you can receive, get this, I'm going to give away 100 of those leads for free. And what's good about them, they've never heard of Devoted, which is good. I'm sure they've heard of United and Aetna, Cigna, and all these other companies out there. So you can be the first on the scene with them that they've never heard of this. Okay. And these are pre-qualified leads, not some lead lists or leads have been worked 10,000 times. They hand off. These are pre-qualified leads that need a good agent to help them out. That were never finalized, because we always have an overabundance of leads. We're sharing those with you at no charge. And then we do have rollover leads. We'll get in that in another topic. We have a whole extensive lead platform that'll blow your mind. Next slide, Michael. So additional global perks before we wrap up and take some questions. You're vested day one with us, 100% vested. We don't make you wait 2, 3, 4, 5 years like some organizations. You're vested day one. So if you decide to walk away, your book of business is yours for life. Lifetime renewals. That's a big part of why we're in this business, why I get a lot of people from these massive call centers jumping ship and joining us, because in those call centers, they don't have any renewals. I was on a call last night with a group out of Chicago, and they put thousands and thousands of apps on the books for this call center, and they don't get any renewals. So you get lifetime renewals with us, okay? With all our carriers, you get to build your own agency if you'd like to do that. Some of you guys have aspiration to become a GA, MGA, SGA, or even an FMO. I'll help you do that. That's what I specialize in, growing teams. We have a virtual training library, about 250 some hours worth of training on every topic in this business, from veterans, how to handle total care, how to, cross sell different products. We have all that for you. And we do live training sessions every week. We have local leadership in your key markets to help you get the support you need. And no Devoted does. We have it as well. We also have best in class technology with integrity, and the global technology team is pretty impressive in terms of what we have in terms of enrollment processes. Anything you need technology-wise, we have it. If we don't have it, guess what? We'll develop it for you and get it. What I like to highlight to you is our settlement options. When you're deciding to leave the business for whatever reason, which touches my heart, why I'm in this business, to help my team, my brothers and sisters that are part of the global family. We are a family. If they go through a crisis, health challenge, or just decide they want to retire, they're able to cash in their book of business. We'll make a settlement option for, in many cases, hundreds of thousands of dollars, even millions of dollars for their book of business. So that's something we offer that a lot of IMOs out there don't do, because there's going to come a time when you're not going to be able to do this business. You're going to come a time, God forbid, but you may come down with a critical illness that, you only have a few months or years to live, and why wait, 8, 9, 10, 20 years for your book of business to pay the renewals? We'll give you a lump sum settlement on that. And we can get that done in process in about 30 days, which is pretty impressive. We have co-op marketing dollars for not only the individual producers, but the agency directors. That's something we started this year to help out the agents on the street. So we got agents that have received $10,000, $15,000, $20,000 of co-op this AEP to help them with, social events, lead drops. If they set up a kiosk, if they want to get a banner on their car, a wrap, we do all those things to help our producers, those that are making it happen. So we co-op with them to help them drive their business. So that's a big thing that we do that a lot of IMOs don't do. We actually pass co-ops to the producers as well as the agency directors. We do right now a $1,000 recruiting bonus. So if you have an agent friend out there that's looking for a new home, we'll pay you $1,000 for every referral you send to us. So if that's 10 agents, 20 agents, you get $1,000 for each. We're also this year doing a leadership summit. We're going to Grenada. We pull all our top people from around the country. We go down to a nice location. This year we're going to Grenada for July 2023. And we just fellowship. We do some work, so it's compliant. It's not just all fun and games. We actually have guest speakers. We go over best practices. What I love about that meeting, we actually have a round table of all the top 6 and 7 figure earners within Global, and they share their best sales idea, marketing idea. So it's like we might have 50 people in a room, and it's amazing to get 50 amazing ideas in one meeting. And then this year we brought back something special. The Rolex Club, we used to do that back 20 years ago, something we did for our top producers. So that's something we're very special. It's the honor for people that are writing, life insurance, final expense, whatever, annuities. We like to make sure we recognize our top producers. Next slide, Michael. All righty. Boy, I got it done, Michael. I know I went over my 5-minute time limit, but again, I want to thank God for you guys being here today. It's been a blessing this year, blessing to have Mr. Ed Park. I do want to throw the mic back to you since you kicked this off. Our Chief Recruiting Officer, Michael Kaplan, back at you, big guy.
Thanks, Tony. Yep. I'll keep it brief, you guys. I know we're in the midst of AEP, so we appreciate you joining. But real quick, I get these questions all the time on these webinars. Like, for example, if somebody wanted to get started with Global or take advantage of the co-ops or get their free leads or whatever the case, they always ask, what do I do? How do I get started? Well, the link's in the chat box. If you open up the chat box below, there is a link to get started, but I'll also send that to you later via email or text, whatever you prefer. Number two, I always get asked, hey, I missed the beginning part where I had to jump off early. Can you send me the recording? Of course, absolutely. Be happy to. So we're going to send that to you as well in that same email, along with the contracting instructions. And then lastly, finding out more about us here at Global, or for that matter, Devoted. We've got weekly sessions every Monday and Wednesday. In fact, this morning we just had one where it's an open forum Q&A. Sometimes there's presenters, guest speakers, a new product, whatever the case. And we do that every week to make sure there's the engagement, so that if you do have questions or there are concerns or there's challenges or changes, we don't want to wait several weeks or a month or two just to get the solution. We want to make sure we're always keeping pace with the industry changes and making sure we get you guys the solutions that you really need. So with that being said, if you do have questions, feel free to reach out to myself or Tony Holland. I'm going to take a moment here to give you guys a chance to screenshot that, but then also I'm going to put that in the chat box as well. So if you have questions, concerns, comments, please don't hesitate to reach out to us. I'm going to put my number here as well, 443-478-2853. And that's in the chat line there. So if you have questions, if you need help, if you need the recording or whatever the case is, please reach out to us. Let us know how we can help you. And then if you would like to get started, my number, you can call me toll free anytime. It's 877-864-9317. I'd be happy to take your call and answer whatever questions you have. And then, of course, the contracting link there for Devoted from our guest speaker, Ed Park, today. I'm going to put that in the chat line again, even though it's already in there. So if you scroll through, you'll see previous comments and messages. But the link is in that box again. So I urge you guys, if you like what you heard today, or if you want to know more, reach out to us or get your contracting started, because that's going to truly change the way you approach the Medicare Advantage market. And Tony, with that, I'm going to throw it right back to you to close out.
Okay. So do we have any other questions real quick that I can knock out that have been chatted in, Michael? Because I want to make sure we take care of that before we close. So I think we do have like a minute or two before the hour.
Sure. I see. I take my glasses off for this one. And by the way, you guys, the executives from Devoted have been able to answer some questions throughout. So I know Wesley Highland, I appreciate that, and Sheffield Young have been able to answer some questions. But Maurice was saying these lead programs are available to agents who are also contracted with other IMO. I'm not sure if that's a question or a statement, but in the regards of the global leads, those are available to global agents. So if you have one contract with us, whether that's final expense, a life insurance, Medicare, final hospital indemnity, whatever the case, our leads are available to any agent that's got a live contract with Global. So I hope that addresses your concern there.
Good.
Again,
Good.
Yeah, you guys do have the ability to unmute yourselves if you'd like. I see another comment. I'm new to Medicare. Where do I find the Medicare information? Where do I find client information using Social Security, date of birth, and the plan they have, and so on? So that's a great question, Tony. Again, so they're new to Medicare, looking for info. What's your suggestion there?
I think they should call you at the end of this meeting, and then you can bring them up to speed in regards to that question. Great question, by the way. But that's something that's going to, there's a long answer to that. I would reach out to Mike at the end of this call. Great question.
I'd be happy to, Gladson, I'd be happy to communicate with you on best practices, who you should talk to, all the documents.
And there's a lot of compliance too. So that's another reason why we need to have a one-on-one with you, because you just can't just call people blindly with phone numbers, social security numbers. There's a lot involved in that. And we'll bring you up to speed with that. A great question. Next question, Michael.
Certainly. Yep. Does Devoted have an option to do telephonic enrollments for customers that aren't necessarily tech savvy clients?
Yeah. We were actually one of the innovators of that back in 2014. And that's why during COVID, we had probably our best year ever, or other IMOs and organizations were struggling. We already had that in place. So the answer is yes, explanation point. Yes, we do. And we have different, variables of that. A version of it could be, the VCC, virtual call center, where you're actually setting in a call center from your home, or just using virtual tools as a hybrid. We have a hybrid model and a call center model. So yes, we do have it. Great question. And that's another one you can hit Michael up at the end of this call in regards to that option. Great question. What else do we have, Michael?
Awesome. Yeah. I'll give you guys another moment to type in your question. I think that's the last one we have.
Okay.
Glad to.
Wonderful.
Definitely give me a call for sure.
Yeah.
I'd love to connect with you.
Absolutely. And Michael, if you would like to go ahead and go to the last slide, we'll wrap the meeting up. As I said, I wanted to make good stewards of your time. And as Michael said, I've been doing this for 28 years, about as long as he's been alive. And I've seen success at the agent level, in a life level, final expense, ancillary, Medicare. I've been in IMO, FMO, GA, MGA. I've seen it all and done it all. I've counseled people that, were struggling in a rut and helped them get out of that rut. We have team members in their 70s and 80s making it happen. Our top guy right now is 74 years old and had 2 heart operations this year out of Phoenix, Arizona, Randy Standard, and he's killing it. But we also have these techies. I got a 26-year-old Joshua Shen out of New Jersey that's got his 90th sale already with us, and he was a number one guy, a salaried agent, a career agent with United Healthcare. Jumped ship. He was our number one guy, and he's killing it with us. Now that he's a broker, he sold the light. So we can service you whether you're, you want to do it old school like Randy Sterner, or if you want to do it over the phone, we have that. Bottom line, it comes down to be successful in this business. Number one, you have to have the right attitude about it. If you're just in this business to make a quick buck off old people, get out of the business. Go do something else. This isn't a business for a bunch of shysters and con artists. They're the reason why we have all these CMS rules to begin with, because there's people out there that'll do anything, say anything to make a buck. Okay, it's not what we're about. It's about, as Ed Park said, the culture of the company, loving on people, okay? You got to understand you have to have the right attitude while you're in this business. The money will come if you're in it for the right reason. And you got to, and going along with that, in sales, the main thing you sell in sales is not a product, not a company, not a rate, none of all that stuff. You got to sell love. Going along with that lady that said, I can't remember her name at the end of the presentation with Ed, love is the foundation of what Devote is all about. Love is really the foundation of sales. Think about someone that has ever sold you a house or sold you a car or sold you any product. You connected with that person on some level. They had to like and love you, them. It's about building a relationship. It's not about pushing product. And that's why these people in these call centers, these JJ Walker commercials, one of the biggest con things going on in this industry. Another reason why we go out all these new rules, because the JJ Walker and Joe Namath commercial has pretty much muddied the water because of the con job they're doing on people. Those people just push it up and move on. They don't care about them people. And that's why they have the worst persistency in the industry. They're losing 80% of their business because people figure it out and then they file a complaint. This is about a relationship. These people are going to become your mom and your dad. That's the way I looked at it when I started. I want to make them my mom and dad. We're building a family. I want to be part of their family reunion. I'm coming to their Thanksgiving dinner and their Christmas dinners. You understand? That's the kind of relationship. So please, whether you're with us or not, please understand why we're in this business. To sell love, sell hope to people that are challenged out there. This isn't a regular sales job. This is completely at a whole nother level. If you're in it for the right reason, we'll help you get there. And you got to come along with the right work ethic. This isn't a side job. I had a guy talking the other day. He does it 2 hours in the morning and Saturday mornings for 2 hours. This is not a freelance. You're not going to make 6 figures doing a freelance deal on this. You're just not. Yes, we do have part-timers. There's teachers. I got one of my top new guys is a detective police officer. Can't leave his full-time job, but he's doing it part-time, and he's got like 40 enrollments already for his first AEP. So we do have full-timers, we have part-timers, but I'm not really into the freelance person that's going to do it for 2 hours here, 2 hours there. You got to be committed to the industry because it changes all the time, okay? So you got to have the work ethic, okay, especially during AEP. And thirdly, you got to have the skill sets, okay? You got to know your stuff. You got to know, how Medicare works. And we'll teach you all of that. But it's just like, if I went out to try to do a John Gordon on our call mastermind this morning, he's like, I don't think any of us would want to get heart surgery. And you see the heart surgeon reading from Cliff Notes before he operates. That was a great analogy. You need to know your stuff, and we'll help you with that. So hopefully you guys see why Ed Park and the Boda Company is so special, and also prayerfully see why the Global Premier Benefits, why we've been a leader in our marketplace, because we're all about changing and saving lives, and we're all in this great mission that the good Lord has put us here to make a difference in these seniors out there and help eliminate the distractions and the misinformation and really offer them true peace of mind, and so they can enjoy their golden year. So I want to thank you guys. May God continue to bless you all. Thank you for joining today. I look forward. Call me. You'll be shocked. People are shocked when they call me that I actually pick up. You're not going to get some phone service or or never hear from me again. I call you. I mean, if I don't get to you right away, I'll call you by the end of the day. I assure you that. Call me. We'd love to talk to you. May God bless you. Thank you, and have an awesome day. Thank you. No, thank you.